Good afternoon and welcome back to the teleconferencing session for the post-basic BSc nursing students, third year students precisely. We will be discussing now about BNS 111, that is Nursing Education and Research. As you know, this is an area which is quite new for you. But when our experts discuss or when you go through the material, you will know that there are certain concepts which you know. It's only you did not know the terminology being used. So you need to spend more time on some of the areas in nursing education and research and nursing administration, because these are some of the new subjects for you. Also, I would request the regional director. So far we have not got attendance from anywhere. May I request once more the regional directors to kindly give us the attendance. The nursing education and research, dear students, has got 4 blocks. Block 1 talks about what is education. What is nursing education? It talks about the philosophy, discusses about teaching learning experiences, also what are the educational communication media which you can use as students while learning or while teaching to people, what is guidance and counseling in nursing education and the counseling process and approaches. In your block 2, there is a discussion about curriculum development and implementation, whereas block 3 and block 4 are dedicated totally to nursing research and statistics. So today we will talk about what is education, what are some of the aims, or what are the different types of education or forms of education, what do we mean by philosophy, what is the relationship between the aims of an educational institute with that of philosophy, and how do we talk about philosophy of nursing education. We have the 2 experts sitting over here with us. They were with us in the last session, Mrs. Santosh Mehta, who is the senior lecturer at RAK College of Nursing, and Mrs. Patni on extreme right is also senior lecturer at RAK College of Nursing. These senior faculty members had been a part of developing these programs and also implementing, so I am sure they will be able to answer most of your questions. Now, as you know, education is a lifelong learning process. If we take that as a lifelong process, how would we try to elaborate it in terms of nursing or nursing education? Mrs. Patni, please.
Thank you, Mrs. Kapoor. As Mrs. Kapoor has rightly said, that this is lifelong process. So in education, we cannot say that I have completed my education, because there is no end to completing the education. There is so much advancement in knowledge and it keeps on changing, and we need to change ourselves in education. Now, what is education? First of all, we need to know what is education. I would say that it is the human being who have the privilege of getting education and being more civilized and knowledgeable and have a good life with the education. It has been said that without education, a person is just equal to dead. So we can say how lively the education is. The literal meaning of education has come from a Latin word that is educatum, that means to lead. Education will help us to lead a healthy, a normal life and a civilized, a good life. So education will help us to have a good life and a purposeful life. Sometimes if we have nothing to do, and once we complete our study, we say, oh, my life is just purposeless. So this education will give us some purpose in the life. Now, there are different definitions have been given by different educators, which are very, very important, because Swami Vivekananda has said that education is manifestation of perfection already in man. That means we want the person to be educated, the potentialities which he already has. It is only we have to draw those what potentialities a person is having. If we don't give the chance, suppose a person who can sing well, if it is not given the chance, we cannot understand that whether the person is a good singer unless is given a chance. So it is a person has the potentialities and the chance has to be given, and we have to draw best of the person. Then Aristotle has defined that this is creation of a sound mind in a sound body. That means if we are educated, a person who is educated will have sound mind, and sound mind leads to a sound body, and vice versa. If we have a sound healthy body, we will have a sound mind, and vice versa. Then it is also said that it is natural, harmonious, progressive development of man's inner power. It is a natural. That means You cannot force a person to get education. It comes from within. That naturally a person wants to be educated, and that has a better impact on the education. It is harmonious. Harmonious means it has a development in all spheres of your life, and it is progressive. When education takes place, we ensure that some sort of progress has taken place in a person. That is a change in behavior. If a person has a change in behavior, we'll say that person is educated. Now this behavior is not that the person will start behaving in a better way, but this is a behavior that there is better knowledge, attitude and the skill. So if we have advancement in knowledge, we can say that there is progress in education. John Dewey has said that this is power by which man is able to control his environment and fulfill his possibility. Now it is also that a person who is educated has better adjustment in a situation. We shall be able to adjust better in any environment and even modify our environment according to the needs and fulfill all those possibilities which are there, which we need. There is also an important definition that develops the inner potentialities. As I discussed earlier, that this is what a person is having the capabilities, we try to draw best of the. Now, very good definition given by Mahatma Gandhi is that it is all round drawing out of the best in the child and the man. That means drawing all round development. We don't say that you only have to learn through books or you only have to learn your skills. No, it is all round development, that is physical, mental, intellectual, spiritual, moral, personality development. So it is all round development is an education. Now this also need to remember by Redden and Ryan, who has given the definition that this is deliberate and systematic. Deliberate means it is purposeful, that you must have some purpose for education. If you are doing a BSc graduation, there must be some purpose that why are you doing this course. If you have no purpose, then you will not take interest in doing your course. You will say, why I'm doing? I'm not getting anything out of it. So you will have disinterest in your studies. But if you have some purpose that you are getting graduation, you may do post-graduation, you are advancing in career, that will help you in better successful for education in BSc. And it is systematic influence. That means it has to be systematic in steps. It has well planned, organized curriculum, and through which we have to go through that, and that has to have the beginning and the end. So that is a systematic influence by the mature person over the immature person. The mature person over here is the educator who is teaching. The students are the immature person, with the effect that immature person becomes a mature person through various instructions, discipline and harmonious development, and this will lead to all-round development, that is physical, social, intellectual, aesthetic and spiritual development. So when we talk that person is being educated, we must see that it is all-round development, not only bookish knowledge or gaining skills, it is otherwise also the whole personality should have impact of the education. So this is what is actually education.
And also it is said that education means change in the behavior of a learner, individual. If a person has done, say, the higher education and there is no change in behavior, then I think that doesn't call for learning has taken place. So that's what is very important. Now,
in fact, it is also said a permanent change in behavior.
Permanent change.
When we talk about permanent, like sometimes we have learned this and then we forget, that is not education.
That's right.
Education means it brings throughout the change, and that becomes a permanent change in behavior of the person.
Right. Now education can be formal, informal and non-formal. How do we differentiate this?
Yes. The forms of education, as you said, it can be formal, informal or non-formal. The formal education is what we go through, like in the classroom setting or in a planned organization like school, college or any type of organization where education is planned. A course is there, prescribed course is there, you go through a course, there is a system of evaluation, maybe in terms of examination or whatever is the strategy which is adopted. So that is a formal education. Then there is informal education, which is not a formal education, and it has also incidental type of education. where the need arises and the education takes place, or where you have something which is of specific agencies are not there, but the education still takes place. It may be in the religious organizations, it may be in some groups where you meet and there is a one-to-one interaction or one-to-group interaction and the education takes place, or day-to-day learning is there, or when there is no prescribed syllabus for learning. So that is what is informal education. You learn, but it is still not a formal organized type of a system which is through a organized agency with the purpose of education, but it is from day to day need arise. Then there is non-formal education. By non-formal we mean intentional, of course, but incidental learning is also there. It is not a formal system, it is outside the formal system, but it is a educational aim. And then it is with the deliberate plan of education. You may have outside the formal system, like for example, you have so many different sessions which are there. You go there, you hear, and then there is some, like for example, you go for some conference which is open to public. You go and learn something and come back. That is also education, but that is not with a prescribed course or curriculum. That is non-formal education. So there is more flexibility in this type of education, and it is also a lifelong process. You always don't have to go through a formal course, but non-formal education is also a part of lifelong, and it is a lifelong experience also which leads to a education. Then there is also a social or adult education which is also a part of non-formal education. So
I think these are very good examples which you have given, and in nursing also we have a formal education, informal education and non-formal education.
Yes.
Formal education is like they are going through the graduation,
BSc,
post-basic BSc nursing, IGNO or convention method or master's program or PhD. The informal is that, for example, we find that the number of nurses have joined the ICU, so we pre-plan that as many nurses join the ICU, we take the training for them, you know. So that would be deliberate and pre-planned. And non-formal education will be within the formal and informal. We find that all the nurses really need to be educated on universal control, universal precautions for infection control.
Yes.
And that's taken as a formal, within the formal and informal, so that, you know, people are prepared and the objectives are achieved. So that's where it becomes a kind of non-formal education. We have a couple of students sitting in the studio. Do you have any question to ask from the experts so far? Any question you have? No, not as yet. So if you have any question, you can ask. Any question from any of the regional centers? Students may kindly ask the question from the experts. Well, we see, and many of the educationists now, Mrs. Patni, believe that education is a process. When we say education is a process, how do we describe it?
Yes, we can say that education is a process, because again it is said that it is continue. As I would again emphasize on the first which we talked, that is a lifelong process. That means there is no end to getting education. Now what is this process is? That there is interaction between the educator and the educand. That means there is influence of the teacher over the student. And also there is interaction. That means there is interaction between the learner and the learned. In education process, when there is interaction between the teacher and the student, so what teacher teaches, the students take up that. And it is a process because there is a feedback of the teacher would like to know that whatever he or she has taught, have the students learned, or is there any deficiency in learning. So when these two interact with each other, then teacher makes sure that students learn the same whatever teacher is teaching. At last maybe the student should have the same knowledge what the teacher has. So this is the influence of the mature over the immature person, to make the immature person as mature by gaining knowledge, skill and the attitude. So when we talk about this interaction, it is a bipolar process, because there are two people, there are two poles, that is the teacher and the student. Now this cannot take place in a vacuum. it has to have some sort of environment. That can be a classroom, that can be a group of students, that can be in the society. So it needs to have a social environment. So it is said to be a tripolar process where there is interaction between the teacher, student and the environment. So the teaching takes place in an environment which there is interaction between the teacher and the student and getting the feedback, and teacher is ensuring that students are learning whatever teacher is teaching. Now this we usually say that teacher is the role model for the student. So usually students follow the same whatever teacher teaches or whatever teacher does. So it is the impact of the teacher, whatever he or she does, will change the personality of the student, how they have been developed by the teacher. So this is what we can say, education is a tripolar process where there is interaction between the teacher, the student and the social environment.
So it has to be either bipolar or tripolar. And actually it is a tripolar which is more effective.
It is
because
actually tripolar because it cannot take, education cannot take in vacuum.
Yes.
It has to have some sort of social interaction, talking to the people, or in the social environment has to be there. The teaching environment has to be there where the education takes place.
Okay, now I think education we take is it's a planned and purposeful. And when we say it is planned and purposeful, it has very clear aims and objectives.
Yes.
There are certain activities planned so that one is able to achieve those aims and objectives. Now, what do you think are some of the factors which determine the educational aims? Because that's very important, that there should be some factors which tell us that the aims can be developed because of these educational factors.
Yes. The aims of education, as we have been discussing, that any education is a purposeful activity.
Yeah.
We have some directions or goals with which we pursue education. It may be formal or informal or non-formal, but there is some objective behind it, and that is what leads us. Like Mrs. Patni was saying, that unless we have some aim, we are not interested in the education. Similarly, when we talk of aims of education, there are some factors which help us to develop the aims of education, like for example philosophy. What is our philosophy of life? If we want to learn further, or if we want to progress, or we want to advance our knowledge, then only we will be going in for education. So our aim of education will be derived from what is our philosophy of life. Do we want to progress in our education or knowledge or skills or any type of special knowledge which we want to attain by going through an exercise of education, or it is elements of human nature which also helps us to develop aims of education. Like for example, as an individual we want to learn how to cure people who are sick, or how to take care of people who are sick. Now these are the aims of medical education or nursing education, which is helping us to prepare that course and to go through that course, because there is an aim to teach people how to look after sick people. Then religious factors may be also there, which may help us to develop some type of education, and that is one of the factor which helps us to develop the aims. Then political ideologies. Now what are the political ideologies? Like for example, you have some characteristics, educational aims which are led through the political agencies, or like for example, you want to be a good citizen. That is a part of the political nature of our living being. Then is the socio-economic factors, which also helps in developing aims of education. Like for example, socio-economic factors lead us to have higher productivity or industrialization or advancement in technological knowledge. All this will help us to develop aim, which will help us also further to prepare courses on these aspects. Then exploration of knowledge. Like for example, you will be learning research in this course only, where you will be taught how you can explore the knowledge which is already existing, or some new knowledge you can add to in the field of nursing by doing nursing research. So exploration of knowledge is also one of the factors which helps us to develop educational aims. So I think these are some of the factors which helps us to develop educational aims.
Can we have this slide? You can.
Yes, this summarizes how and what are some of the factors which will help us to develop educational aims.
I think we have, the student must have got a clear idea about aims and what are the factors. Can we discuss what is philosophy and what do we mean by nursing philosophy, Mrs. Patni? How do we describe philosophy and how do we relate it to the nursing philosophy? Because this is one area where we think the students need to learn that the beliefs are the one which helps them to develop the knowledge and skills. So what do we talk about philosophy of education, Mrs. Patni?
Yes, as Mrs. Mehta has rightly said, that philosophy helps us in having our aims of education. Now, what is your philosophy of life will determine your aim of education. Before that, we need to know what is philosophy. Philosophy is actually, in simple terms, it is search for the wisdom. That means a person who wants to explore more and more, or who wants to know more and more about the world, or wants to get the answers of various questions, is what is philosophy. So philosophy and education has very close relationship, because philosophy is what do you believe in, what do you want to know, or what do you want to be. So this is a science of knowledge, and philosophy is also a living force or a way of life, an attitude towards life, and search for the truth and the reality. So when we talk about philosophy and education, they are closely related to each other, because philosophy is giving answers to the questions and education will help us to know what type of education is required for a particular discipline. Like for example, nursing education is that we want to have depth of knowledge in nursing, that how to give quality care to a patient or to a client or to a community. So when it comes how to give care, this is a question and the answer will be through philosophy. Now, to be a nurse, this may be one of the, I would say, aim of education or nursing education for a nurse, that my aim of life is to give care to the human being. So when this is her philosophy, then definitely nursing is one of the important profession which can be taken to fulfill her philosophy of life. So this philosophy will help her to select a nursing profession, and nursing education will give the education a sort to fulfill her philosophical views that she wants to give care to the human beings. So there are three types of main philosophies, that is idealism, naturalism, and pragmatism and eclecticism. There are four types. Now these four types of philosophies are having different meaning by different philosophers. Now there are so many philosophers who have given answers about various aspects, what is world, how it exists, and what is science, what all is included in the science. All these answers are through philosophers. Now according to the philosophy of idealism, this is that ideas as the basis of philosophy. Now in this it is said that a person who is exposed for education, it comes whatever comes into his or her mind, or whatever comes to the idea of a person will help the person to get an education. And when we talk about naturalism, naturalism is that the philosophers, they say that leave the person in a nature and let the person educate itself by natural. That means whatever he or she comes across will be learning for a person. And when we come to the pragmatism, they believe that it is learning by doing, by action. That means if you want to teach somebody or if you want to educate a person, let the person do the things and then learn those and getting the education. So these three philosophical views help that how a person should get an education. That is either through ideas which comes into a person's mind, or it is by nature, whatever comes through Like if we talk about animals, nobody is teaching them. They are just exposed to the nature. The cause they just start walking without any help or any learning. So this is how they are left to the nature and they learn by themselves. And then pragmatism is that you must do something. That is how you will learn better by doing. Now eclecticism is actually the fourth and the synthesis of all this. If we say which one is more important, all these philosophical views are important at its own place, and eclecticism is the synthesis of all these philosophical views. Say that education takes place by all these three philosophical views. So these has to be included in education, and education guides, philosophy guides, it directs the type of education required for any type of discipline, whether it is nursing or it is other teaching or it is medical profession or it is whatever we select, it is all through the philosophy. So if we talk about nursing education and philosophy, that what type of nursing subject should be there, how should we take care of the patient in the hospital, how to take care in the community health, what type of book should be referred, what type of syllabus should be there. Now these are all questions, and how to evaluate the students, how to gain their knowledge, attitude and skill. These all questions will be answered by the philosophical views of the education.
I think that's very important. Now, before we talk of philosophy of aims of nursing education, I thought let's build it on a philosophy of nursing education first, because based on the philosophy the aims develop.
Yes.
Because a philosophy of nursing is to help the students have those kind of learning experiences where they can prevent the disease, promote the health, and also provide care which can be, in the hospital community, and also rehabilitation. So that's the philosophy of nursing for which the nurse is prepared. Now nurse is prepared to do all these kind of multifactorial roles based on some philosophy of nursing education. So what is that philosophy of nursing education? Mrs. Mehta, would you like to
Yes, I
explain
think
it?
Mrs. Patni has already talked at depth what is philosophy, and she has also touched on what is the philosophy of education. Now here, nursing education is part of other education. It is not something different. So we have that also as one of the area which we can talk of philosophy of nursing education, but there are some additional aspects which we may consider when we talk of philosophy of nursing education. Since nurses deal with human lives, so the individual human life values are to be considered when we talk of nursing education philosophy. Like individual has intrinsic values and there is a worth inherited in the human life. So we have to be life conscious, or we have to have a human life factor when we talk of nursing education. Then nursing is a rational activity. We have to reason out, or we have to justify any action taken by nursing, like any procedures we carry out, any type of teaching we do for nurse students, we have to reason out. Like other sciences, we have reasoning. Similarly, in nursing also, we have to rationalize. Then nursing is a unique in its own way, and basic social, biological sciences are involved in nursing, because there are the functions of nursing involved in promoting health, which is a combination of biological sciences and social sciences. The individual nurse citizen has also responsibility as a political and social milieu in which she lives. She herself is also a citizen, so she has to perform the role of a good citizen, and she also has to create an environment which is of a social and political environment. She cannot be away, or she cannot live in isolation. So when she is dealing with her clients, maybe in the institutional setup or in the community health setup, she has to keep this political and social environment. Nursing is a process with a central subjective purpose of an inherent organization of system and dynamic creativity. It is not that stereotype of activity. You have to think or you have to plan your nursing education as per the recent developments. Like earlier, we were not having any computers, or we did not have any type of management information system which is related to today's computerization. So with the recent development, we have to be more creative in our thinking, and we have to also be as per the advancement of technological advancement. So the nursing philosophy also aims at what is the today's system. With that, it should be working. The nursing functions are interdependent and are in collaboration. We have earlier also discussed that nurse works in a team with other sectors. In community health we were discussing. Similarly, there has to be collaboration, and there is interdependence with other functions in the society, in the community, and also in the other education sectors. It cannot be in isolation. Like in third year now, you have even computers in nursing. So that is with the belief and philosophy of nursing education. Then nursing is a professional practice which must be reflecting professionalism. We should have the characteristics of any professional practice in nursing. So that is what is the philosophy of nursing education, that it should reflect the professional practice. Nursing roles are in order of priority in education. Whatever functions and roles performed by nurses are the basic beliefs that there should be priority. We should consider the priority of any needs, health needs which are to be planned, or the nursing interventions which have to be planned. So nursing education also should aim at priority needs. Democratic mode of operation and implication of democratic mode are to be reflected in the nursing aims and nursing functions. So nursing education should reflect to the democratic society, and as the political system also reflects to nursing as a citizen, nurses as citizen, so as a part of that it should reflect the democratic roles and functions.
I think I just want to add up over here that in a nursing foundation course BNS 101, you must have read also about the nursing functions by Harmer Henderson, by
Yes.
Nanda, by classification, by Faye Abdallah, and you know that Harmer Henderson has mentioned the 14 functions of a nurse, and out of which all 13 are independent function, whereas one is a collaborative function where she or he carries on the responsibility as prescribed by the physician. The interdependent roles are also very evident. Likewise, Faye Abdallah has mentioned the 21 roles which are performed by a nurse, which are all independent functions. That is the nutritional needs, the hygienic needs, the comfort needs, the therapeutic needs, spiritual needs. So all that gives you an example that a philosophy of nursing education reflects all these areas, because philosophy is what you believe, what you think should be there, your responsibility as a nurse, and that's what is taught in the curriculum. Now, having said this, let us go back and discuss what are some of the aims of nursing education, Mrs. Patni. Aims of nursing education. Because you were talking about some of the aims. One of the aims is that we want to give them knowledge.
Nursing education, almost aims remain the same, because what is our purpose of education?
I think like vocational.
Almost should be the same.
Okay.
Now when we talk about vocational, this is one of the aim that definitely we want to have some vocation in our education. Now if
May we
I
have
talk
the
about
slide,
an
please?
example, when we talk about vocation, certainly one person wants to get a job, and nowadays I would say nursing is on the top for getting for career development, for getting a job, so people opt for it. Now if we talk about A&M's course, which has come new as vocational course, because our political system now wants that people should be educated in a way that they should be having some sort of vocation. Now 10+2 is one of the course as A&M course, which a person after 12th, she is considered as 10+2, or she can take a vocation as A&M, or we say female health worker, or she can be 12th and do continue her further study.
Yes, Chennai. Yes, please.
Hello.
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 Yes. Yes, please.
Hello.
Hello.
Madam, how to prevent chikungunya, madam?
So you have gone into community health and medical surgical nursing, how to prevent chikungunya. Anyway, it doesn't matter. I think, would you like
Hello?
to answer? Yes, we got the question that how to prevent chikungunya. Is there any other question?
Yes, madam.
Birds, hai na?
Okay. Chikungunya is one of the disease which has taken up, and it's one of the public health problem we have.
I think government is already taking some action towards preventing from birds to spread the diseases.
No, the mosquitoes, kind of
Rodent
mosquitoes.
borne.
So we'll have to see that the prevention occurs at the home level, where we start educating the public. And the moment they have the fever, I think lot of, now it is not there, because there was a time chikungunya had taken up, the quite a toll. But now nobody dies of chikungunya, of course. It's you have the symptoms of swelling, you have the symptoms of fever, and those kind of symptoms are there. So maybe next month we are going to talk about the medical surgical nursing, and we can talk about it in detail also. So because the time is so less, I thought we can just finish up the aims. How many students are there in Chennai anyway? So at least we got one call from Chennai, and we will take it in detail when we talk about the infectious diseases more in medical surgical next week, and not next week, sorry, on 12th of May. We will have the session and we can talk in further detail. If we can quickly wrap it up with the aims, Mrs. Patni.
So I was just saying is, one is vocational, one wants to get up the vocation. Then not only that, we need to have thorough knowledge about our profession. Whatever we are learning, it should have good knowledge and the skills to have our own professional practice, to ensure that whatever we are doing, it is a right way of giving care to the patient, or we want to give quality care. So we need to learn in all biological, behavior, social and medical sciences. Then it also help us to have leadership qualities. Leadership is that more knowledge means you are better in your position, and you are better guiding the people, and this is you can influence the people better. So if you have good education, the people will be influenced by you, and you will have the leadership qualities. There will be more responsibility, better collaboration and coordination. The person will be better in decision making and policy making. You can even find the difference if you do your graduation or post graduation. The leadership qualities will make a difference in the education. Then professional development aim, that this also help us for the professional development. You will see in the recent years, when earlier it was only A&M or GNM course, now it is a graduation, the post graduation, the doctorate. So our profession is advancing and growing so much that it helps us in the growth of the profession. Then personality development aim, as Mahatma Gandhi, I would definitely emphasize, says it is all round development. That means it is not only if I want to know this, I need to know this. No, it is all the personality development of a person. It is not only the curriculum. We must have some co-curricular expertise also, so that we have both balance between this to have a better personality development. Then research orientation. Our mind should be that to find the answers to the questions. If we say that if a person is well qualified, will be able to give better care, not necessarily. That we can do through steps of research by ensuring these steps that really it is true or false. So research should be in our mind. And then democratic. We can be a good citizen of the country. Democracy is that everybody has the right to say yes or no, to vote or not to vote. So we have so many democratic this in our country, that we are free to do many things in this. So democracy means people should also be involved in to be a good citizen of a country. So these are some of the aims of nursing education.
And I think the whole session, why it is discussed about aims and philosophy of education and then of nursing education, because all your curriculum depends upon, the learning of a curriculum depends upon what are the aims of nursing education and what is the philosophy. If the philosophy is clear and aims are clear, curriculum development is not difficult, because then you can develop the curriculum based on the aims and philosophy of nursing education of your institution and vis-a-vis of Indian Nursing Council, which is a prescribing authority. And then the curriculum units development of curriculum will not be difficult. So that is why we spend a lot of time on clarifying this, what is aim of nursing education and what are the philosophies, because most of the time you will leave this unit thinking that it is difficult. But remember that what you believe in nursing, you practice in nursing. What you believe in nursing are the teachers which they are teaching you, and that's where you have to take on the care while practicing the nursing. With this, I would like to thank you Chinay for calling, and we will answer your chikungunya in the, I wish we could do that, but the time was less. But it is mostly a disease which had come as an epidemic in one region, and it was again said that there should not be water storage. Yes, Chennai. Yes, please. Yes, Chennai. Yes, please.
Hello.
Yes.
Hello?
Yes.
Hello?
Yes, please.
Hello, madam. Some
Yes.
patients will come, some VIP letter. How to will democracy work? Some patients will come to VIP letters, madam. We are working in government staffs. How to will treat the patients to VIP, madam?
How to increase? How to... the question is not clear. You are saying how to increase something at PHC level, but I am not able to get the middle word. I'm not able to get, anyway the time is up and they are indicating us. Can you please fax this so that I can answer your question? May I request the regional director kindly take this question of the student and send it to my school. I will answer her question, because the time is up and they are telling us to wind up. Thank you very much, but please send her question to me so that I can send it back to her. Kindly tell her to write her address and I can answer her question by writing her response. Thank you very much. And thank you Mrs. Patni and Mrs. Mehta for patiently discussing about some of the very important concepts of philosophy and aims of nursing education.
Thank you.